So my presentation is on the disposal options during emergency situations. And I will also cover some parameters which are also important in disposal or in management of healthcare waste in healthcare facilities or during the emergencies. The bottom line message on this particular slide, I can say, is that we need to prioritize green or environmentally friendly waste disposal options during the emergencies. As Dr. Uta has already mentioned, that the priority should be on the green disposal options. However, we can opt for the best available technologies, double chamber incinerators or autoclaves. But when it comes to the burning waste in pit or encapsulation, we need to consider these as the last resort. It means that they should only happen when the situation is extremely difficult. It is the last resort. We cannot do anything more than opting to burn in a pit or to encapsulate waste. So let me discuss the do's and the don'ts of the burning waste in pits. The burning of waste in pits, it is, number one, it has to happen in the pit, yes, and it has to be away from the healthcare facility and away from the community, from the public health, from the public personnel, because it normally causes a lot of smokes. It is not an environmentally friendly disposal option, and it can harm healthcare workers, it can harm the community, it can harm environment in general. And what I can say as well on this burning in pit method, burning waste in pit, it is that, it has to, once the waste is burnt, it has to be covered with a layer of soil. We recommend a 10 centimeters layer of soil to be there in order to cover the leftovers. Normally it is something like fly ash, and the wind can come and carry the fly ash, which is not good for the public again. And what I can say, we don't advocate for this. Let us try our best to come up with disposal options which are green, which have got lesser environmental impacts and lesser impacts to the public personnel. And let me come to the encapsulation disposal method. Maybe I forgot something to mention hereby on burning in pits. Burning in pits is mostly for infectious materials. And you see, it can also happen for, I cannot say non-infectious, but it is mostly for infectious materials. And for the encapsulation disposal method is mostly for expired pharmaceuticals or medications and expired vaccines. So how does it happen? We normally have some questions about encapsulation. How is it happening? What are the advantages? What are the disadvantages? So let me take you through the do's and the don'ts of the encapsulation. What I can say, it's like encapsulation itself is a method of confining hazardous materials by mixing the materials with cement, lime, and water into a hard substance, something like a block, and normally it happened in a drum, a metal drum. And the key here is waste minimization or waste reduction, because at the end of the day, you will get bulk materials depending on how you prepare your waste before the disposal. Let's say the expired medications. For the expired medications, they need to be removed from the packaging materials. Even in the sachets, they have to be the real tablets. And once you remove the materials from the sachets or the tablets from the sachets, they have to be grounded, ready for the mixing with cement, lime, and water in order to come up with a block-like substance in a drum. And we should remember that this encapsulation is also not recommended. Why? The reason is it creates, it's like potentially bulk materials that at the end of the day, they require further disposal somewhere. There are scenarios whereby these materials can be of use. For example, in Haiti, I remember we were using it for land reclamation, but still, in most cases, they end up being like bulk materials that require further disposal somewhere. But all of us as WASH stakeholders, we can try our best to limit the use of encapsulation disposal method during the emergencies. And how this can happen, this one is possible if we can advocate the use of or the implementation of stock management to avoid wastage and to avoid expiration of medications during the emergencies. So these can happen. Next slide. Oh, thank you. So our next slide is about healthcare waste management officer or staff. I can say staff, but I would like to go into details on the waste management officer. The question that I would like all of us to have, it is like, why do we need waste management officer in a healthcare facility or for a particular emergency response center or response intervention? And who exactly this person should be? I would like to start with the reasons why we need waste management officer. So we need waste management officer for many reasons. Number one, we need the waste management officer to oversee waste management activities. You see, waste management activity is similar to other activities. We need someone to be there to oversee how it happens. Number two, we need to provide supportive supervision. And this is the key function of the waste management officer. When I say supportive supervision, is the guidance. It's like telling the waste management staff how to do it rather than directing them, because this is like, we know waste management staff, it is the low cadre staff, they really need good supervision, and this is supportive supervision. Not already their burden is too big, they don't need to be told, do A, B, C, D. No, this is how we do it. Another reason is that we need waste management officer in order to develop, implement, and revise waste management plan. Without plan, you cannot implement. We need the waste management officer to be there for that activity. Another activity for waste management officer, as we can see from on the slide there, is to conduct regular training sessions among waste handlers. And this is especially when the waste management activities are subcontracted to a third party or to a company which comes and do the waste management for a particular hospital. The training is also very important to prepare waste management staff to be ready to handle new challenges. You see, it's like now we are in COVID-19 pandemic. We need to prepare waste management staff to deal with the COVID-infected waste. They need to know the IPC measures, how to deal the do's and don'ts of the COVID-19 infected waste. Number five, we need a waste management officer in order to ensure occupational health and safety of waste management staff. We also need the person to be able to check compliance. Are we complying, or is the hospital complying to waste management regulations? We need that person for this particular activity. Another important task is to keep track of the waste management stream from generation up to the final disposal point. We need the person to be able to show the data, like this is what I have, this is how we do it. So let us come to who this person is. The waste management officer can be IPC nurse, or can be a public health engineer, can be environmental engineer. The bottom point here is that the person has to be trained. The person has to know what to do, you see, and the person has to have at least a say somewhere. You see, if the person is not attached to IPC team, does not have a say, it sometimes difficult to go and say, okay, this is what I recommend, because already the person feels him or herself like, okay, will they listen to me? Should I go and attend this meeting? That is why we recommend that this waste management staff, should be either from the IPC committee or from the nurses themselves or from a certain hierarchy in the hospital. So next slide, please. Okay, as I mentioned, like one of the activities that the waste management officer has to do is on the documentation, keeping track of waste management activities. So the question here is like, okay, why do we need documentation in waste management, or why do we need to document waste management activities or similar activities? Before I say which documents we need to have or we need to advocate for, let me go on the reasons why do we need documentation. Number one, we need documentation to monitor occupational health and safety of waste management staff. You see, waste management staff can have occupational injuries, can have burn injuries, can have other accidents within the healthcare facilities. So if we know this one, and then we will track what is the cause of this. That's why we need this documentation. And then we need documentation in order to check compliance to waste management activities, especially the minimization and segregation. If waste is labeled well, the waste management staff will be able to say, oh, this one is from maternity ward, or this one is from pediatric ward. So it is easy to know what to do and even to track back who was there, who can be the source of mixing, or who can help us to correct or to mitigate the problem. That's why we need the documentation. And also we need the documentation in order to plan effective maintenance and repair. And not only repair, sometimes the replacement of waste management equipment. If the documentation is not there, it's not easy to know the lifetime when last this incinerator was repaired or autoclave was repaired, so it becomes really, really difficult. Another reason is that with the documentation, it is easy to guide informed decision making in a healthcare facility. So let us now go back to the types of documents that we need for a particular healthcare facility or for a particular emergency response. We need standard operating procedures. This is a document that captures how waste can be managed from generation point, minimization, from segregation up to the final disposal. And it also covers possible hazards, responsible personnel. It covers the point of contact in terms of emergency, what are the day-to-day activities, what are the do's, and what are the don'ts. So this is one of the document type. Another one is the incident reports. I've already highlighted it in some slides that I discussed earlier, that we need to document what are the sharp injuries, what are the injuries that occur among healthcare workers, among waste management staff, and not only to put the document, but to advocate and to give them the morale to really report the needle stick injuries. We also need a type of documentation on the amount of waste which is generated at a particular facility or during a particular emergency. We need the amount to know how much is generated. It can be in kilograms, it can be in pounds or in volumes, depending on how facility can get the measuring equipment. Another type of document can be that of maintenance records. When last was the incinerator maintained or the autoclave? And this one is very important in order to show the due dates for the repair and the maintenance of waste management equipment. Next slide, please. Okay, can you go back? One slide, yes. Sorry. Okay. Safe handling of waste for healthcare workers. Yes, this one is important. We need safe handling of waste by healthcare workers. But how the issue here is how can we attain that? How can we ensure proper handling of healthcare of healthcare waste by waste handlers? So I have some few points here to share. Number one, this safe handling of waste can be attained by understanding the waste management principles, including the handling itself. So this one I can discuss on the side of waste handlers. They need to know how to carry the waste. They need to know that they are not supposed to resort the waste. They are not supposed to carry heavy loads. They are not supposed to carry waste against their body. All these are the measures or principles that waste handlers have to really know and practice. On the other side, it depends on the generation segregation and the entire chain of waste management, because it is nurses and physicians or laboratory attendants who normally generate the waste. It can also be the community. If someone is going with a sick person, this person is vomiting, so it can be potentially infectious material. So it is community involvement. It is involvement of the entire healthcare workforce to know that the management of healthcare waste has impact on the waste handlers, has impact on the environment. So this one is something to communicate within the healthcare facility or during the emergency in order for everyone to be on the same page. Another important element here in order to attain proper handling of waste is the use of right personal protection equipment. And you see, not only personal protection equipment, but personal hygiene as well. Because these two items, they minimize infections and injuries among healthcare workers. The third way to attain safe handling of waste in healthcare facilities is the use of right working tools. You see, these are the tools that they will ease the work of waste handlers. Something like wheelbarrow, wheeled bins, labeled containers, color-coded containers. These ones, they will help the waste management staff to carry their work with ease. And also, very important is the supportive supervision. Waste management or handling of waste requires practical training sessions, requires key messages like don't carry waste close to your body, don't resort waste. All these have to happen in order for us to ensure that the waste management personnel remain safe in order to continue supporting healthcare waste management in a given facility or during a particular emergency. Thank you. Next slide. Okay, here is how to increase sustainability. So I would like to start with, before I say sustainability, let me say all of us as WASH stakeholders, we need to prioritize waste management activities. You will find a very good hospital. You see, the buildings are very good, but when you go to the waste disposal area or waste management facilities, you will really be shocked. So it is time to prioritize waste management activities in all healthcare facilities. And once we prioritize healthcare waste management activities, we'll be able to say, okay, we need to keep it as a principle. We need to sustain this. Sustainability can be achieved by, number one, allocating budget for waste management activities. Enough budget has to be there. And you see, the budget can help to procure equipment and maybe to maintain and repair facilities which deal with waste management. Sustainability can be achieved if the training is performed, if everyone, all the healthcare workers are aware of how to really deal with waste, and the producers of waste as well, the physicians, nurses, all need to know the do's and the don'ts in waste management. Another sustainability parameter is legal framework. We need guidance. We need policy guidelines in order to know, like, okay, this is how the waste is supposed to be disposed of, or how the waste has to be treated. Another point here is continuous monitoring. Continuous monitoring of waste management operations is very key, and what I can say, let us use this opportunity to advocate. You see, sustainability can be attained by advocating. Let us advocate in the media. It can be done through research. It can be done through community education in order to show the necessity, the importance of having proper waste management activities in healthcare facilities. And the fact that this is the year of midwives and nurses, it is good to use this opportunity to build the capacity of the healthcare workers, to demand access to safe working environments. It's better also to ask the community, to build the capacity of the community, or to raise voice, to help them to raise their voice that they need clean healthcare facilities, and clean healthcare facilities cannot be attained if waste management portion of it is not good. And continuous innovation, collaboration, partnership with partners is also key. This one can also allow sustainability, and also attracting and maintaining qualified staff. In many areas, you will see that waste management personnel, in some facilities, you will not get maybe the person. In hospitals where you will get the person, if the person is very good, the hospital, in many cases, some of the hospitals cannot maintain this person, cannot keep this person to continue delivering the work. And see, teamwork is key. Teamwork is key. We need to collaborate, to involve all the partners, to advocate, and to raise voice. And next slide, please. Okay, so these are the takeaways, key takeaways. In discussing the key takeaways, as mentioned, some have been mentioned already by Dr. Ute, is that proper waste segregation at the point of generation is key. See, we say point of generation, this is where waste is generated. It has to happen. And then sharps waste has to be kept in leak-proof container, and infectious waste has to be treated, and also the use of wash fit to continuously assess and improve waste management system is very key. Documentation is also key, and wherever possible, it is good to comply with green environmental disposal options.